So hi, I'm Dr. Bruce Rippey with Bridge Integrative Medicine, and this is one of our trainers and wonderful people. This is our nurse practitioner, Kori. Hi, Kori.
Hello.
Hey. We were going to talk about regenerative medicine as it relates to arthritis, and I know we've been getting a lot of knee patients in, and I'd really like to hear your take on kind of the process. What does the patient feel, first of all? With the arthritis, they tell us they can't stand, they can't walk, things like that. But when they come to see you, how are they, first of all? Are they pretty nervous?
Well, they're nervous because they're going to have injections, but they're excited too because their life has not been very good because they're not wanting to walk, they're not wanting to take stairs, their life is just limited, so they're ready to make that change.
You see it when they try to rise from a seating position.
Mm-hmm.
Right? They try to stand up and they walk their hands up.
And they tell me all the time that they're avoiding, they want to get the closest parking spot, or they don't want to take stairs, especially, things like that.
Yeah. So when they're in there and you have to go through your preparations, you're quite extensive. I've seen you actually lay out all of the materials and the syringe and all that kind of stuff. You want to speak to what we use for the regenerative material there?
We were using stem cells only to begin with, and then we added PRP and exosomes, and now we're going to be using Wharton's jelly.
Which also has stem cells, quite a bit,
right.
Actually, quite a few.
Right.
Yeah, so what I hear when you're finished with the Wharton's jelly stuff is that they walk out feeling like you injected pillows. I really like that.
Mm-hmm. They're usually pretty comfortable.
Very comfortable afterwards, and it seems to be worth it. Does it hurt? Everybody asks me this. Well, does that hurt? So tell me about that. How do you talk to a patient when you tell them, hey, we're going to do an injection here?
Well, usually A, it's a pretty quick procedure, and B, most of these patients have already had some type of injection, whether it be cortisone or hyaluronic acid, so they're somewhat familiar. And they're usually pleasantly surprised that it's not as painful as they had thought.
Yeah, and then of course, do you send them immediately back over for rehab? Because one of the things about like cortisone and so forth, I've heard that you kind of got to lay off for a while to let it take effect.
They're usually not on the day of injection, but the next day they're back in rehab and back on the floor, and the techs know exactly what to do.
Yeah, because you've written them what to do, you told them what to do. But yeah, I think it's great. No, I really appreciate that. It has been one of those things where it's a quick procedure. It isn't overly painful.
Mm-hmm.
Of course, you've been injecting my head, trying to get.
It's true. I'd say that's a little more painful.
We're trying to do hair restoration here, and we'll see. We'll see how that works. But it's been fun. It's been a fun process. We'll see if it works. But very, very different from arthritis.
Right.
So have you used the Wharton's jelly product in other joints besides knees?
Not yet.
Yeah. I think that's coming up.
That is coming up.
That's really good.
That'll be exciting.
What have we been using in other joints? What have you used in other joints besides knees here? You said exosomes, which we've done that, and stem cells. What other joints have we used our regenerative products in?
Shoulders.
Yeah, you did mine.
Yeah.
I was there.
You were there.
Lots better.
What else? Elbows.
Yeah.
Thumbs.
Really? Thumbs.
Did a foot.
You did one of my friend's ankles too. One of my patients that had been for a long time.
That was a while ago.
He came in and showed me that he can jump now.
Oh, good.
Yeah, seriously.
I haven't seen him.
Yeah, I know. It was pretty exciting.
And a wrist. Did a wrist not too long ago. Yeah.
A lot of things. Well, cool. Well, thanks for your help.
Yeah.
Just wanted to let you know that she's a real person. She's really here to help. And it's a quick procedure, and you walk out on pillows.
There you go. Come see us.